Today, students enrolled in the PURCH program at UMass Chan Medical School Baystate traveled to the State House to advocate for legislation related to health outcomes. 22 News State House reporter Ellen Fleming was there and has more on the two bills.
From the classroom to the State House, medical students lobbied lawmakers on bills that will lead to greater health outcomes for their future patients. The first piece of legislation that the group also advocated for last year is known as the Healthy Homes Program. Massachusetts has the second oldest housing stock in the United States, and 70% of our homes in the state were constructed before lead paint was banned. The passage of this bill would tackle a multitude of health hazards like asbestos, mold, pests, and lead, but it would also focus on gateway cities like Springfield by dedicating 50% of funds to owners in gateway cities.
As medical students, we spend so much time looking at our books and studying everything that could possibly go wrong with the human body. And I think one of the most frustrating things is knowing that a lot of these conditions are preventable. And so for me, this work is really about going further upstream and actually trying to address some of the root causes of something like lead poisoning, as opposed to only, learning how to treat a patient who has lead poisoning when they show up in the emergency department.
The group was also there advocating for the SAFE 2.0 Act. Because Massachusetts has 351 boards of health, there are extreme differences in how cities and towns deliver health services. This act would establish minimum public health standards for every municipality, create uniform data collection and reporting systems, and make the Department of Public Health create an estimation of funds needed for boards of health to meet the minimum public health standard. Both bills are currently in their respective Ways and Means committees. Working for you at the State House in Boston, Ellen Fleming, 22 News.